If the heart stops, shouldn't the brain go silent too? That's what we used to think until scientists observed post-death brain activity, a phenomenon where measurable brain waves persist even after a person is clinically declared dead. In some cases, EEG recordings have captured bursts of electrical activity sometimes resembling conscious patterns minutes after cardiac arrest. This paradox challenges our definition of death and raises profound questions. Is there a brief window where the brain stays aware? Could dying be more of a process than a sudden event? But what causes this mysterious activity? One theory suggests that as blood flow stops, the brain undergoes a final surge of electrical synchronization, sometimes called a brain death wave. This may reflect neurons firing in a last attempt to restore order, or the breakdown of ion gradients triggering a cascade of activity. Example, in a 2018 study, scientists recorded a spike in gamma brainwaves, the kind linked to consciousness, in patients moments after life support was withdrawn. Analogy. It is like a city losing power, but lights flicker back on briefly as the grid shuts down. The existence of post-death brainwaves doesn't prove awareness after death, but it hints that the boundary between life and death may be far more complex than we thought. How can measurable brainwaves persist even after a person is declared clinically dead? Electroencephalography, EEG, is used to confirm brain death by demonstrating an isoelectric line, no detectable electrical activity. Yet studies and case reports have recorded residual oscillations or late-onset slow waves in cortical tissue minutes after cessation of heartbeat and breathing. This phenomenon presents a paradox. If neuronal circuits cease to receive oxygen and glucose, how can any organized electrical patterns continue? So far, so good until we examine the physiological subtleties underlying death. The post-death brain activity scenario emerges when the criteria for clinical death, irreversible loss of circulatory or brain function, collide with transient bioelectrical processes that outlast them. In theory, once perfusion stops, membrane potentials collapse, synaptic transmission halts, and EEG readings fall to baseline. In practice, however, ionic gradients and residual metabolic stores can support brief, organized bursts of activity or slow-spreading depolarizations in neurons and glia, challenging the assumption of an abrupt electrical shutdown. At its core, the paradox hinges on terminal spreading depolarization, a wave of near-simultaneous neuronal depolarization that propagates through cortex once energy reserves are exhausted. Paradoxically, this global depolarization can generate detectable field potentials resembling ultra-slow EEG waves. These signals are not signs of consciousness, but rather the final, collective, last gasp of ion channels running down. The phenomenon underscores that electrical silence on conventional EEG often masks underlying low amplitude, ultra-slow dynamics detectable only with sensitive amplifiers and specialized filters. Yet even the most controlled clinical protocols reveal hidden layers of complexity. Postmortem recordings in animal models show that some hippocampal neurons can fire action potentials 2 to 3 minutes after cardiac arrest, fueled by phosphocreatine reserves and anaerobic glycolysis. Likewise, certain glial networks maintain calcium waves that echo through tissue long after neuronal firing ceases, contributing to field potential artifacts. These lingering processes demonstrate that irreversible failure of brain function is in fact a cascade of staggered shutdowns rather than a single instantaneous event. At even finer scales, microglial activation and delayed astrocytic swelling can modulate the extracellular environment, affecting conductivity and signal propagation. Temperature drops postmortem slow ionic leak rates, prolonging electrical signatures, while residual blood pooling alters electrode impedance, sometimes creating pseudo-oscillations. Together, these micro and mesoscopic factors blur the boundary between life and death in EEG readings. In essence, the post-death brain activity paradox reveals that declaring brain death is a clinical judgment based on specific thresholds, not an absolute marker of all electrical phenomena. It highlights the resilience of cellular biophysics, even under catastrophic energy failure, and reminds us that cessation of organized consciousness does not instantaneously erase the biophysical echoes of neural networks. Much like the hysteresis paradox, where history imprints its mark on system behavior, and deep-sea submersible failure, where latent stresses surface under extreme conditions, post-death brain activity exposes the layered, time-staggered nature of biological shutdown, forcing a deeper appreciation for the continuum between life's end and the silence that follows. Post-death brain activity paradox refers to transient electrical signals detected in the brain after clinical death has been declared. These signals often manifest as organized waveforms or bursts of high-frequency oscillations despite the absence of detectable cardiac function. This phenomenon contradicts the assumption that brain activity ceases immediately upon circulatory and respiratory arrest. It highlights that neuronal networks can transiently sustain coordinated activity even under global ischemia. Studies report gamma-frequency bursts in rodent brains for several minutes following induced cardiac arrest. It is like hearing echoing music in a concert hall after the orchestra and audience have already departed. Clinical death is defined by the irreversible cessation of heartbeat and breathing, often marked by a flat electrocardiogram, ECG. Electrophysiological silence, by contrast, refers to the complete absence of measurable brain electrical activity. The paradox emerges because brain waves can persist briefly after clinical death, indicating that neuronal processes outlast cardiovascular function. Thus, the end of cardiac output does not coincide exactly with the end of all cerebral electrical phenomena. Human EEG recordings sometimes show residual activity for up to 30 seconds after asystole. It is like a flashlight's beam flickering briefly after the battery is removed from the circuit. Neurons rely on ion gradients maintained by ATP-driven pumps to generate action potentials. Following cardiac arrest, residual ATP and ion gradients persist for a short time, allowing neurons to fire transiently. Hypoxia then gradually collapses these gradients, but not before brief waves of depolarization can occur. This residual metabolic energy underpins the short-lived electrical activity postmortem. In brain slices deprived of oxygen, transient depolarization waves appear before complete silence. It is like a boat's momentum, carrying it forward briefly after the engine has cut out. Anoxic depolarization occurs when neurons lose ion homeostasis and their membranes depolarize en masse. This can trigger spreading depolarization waves that propagate through cortical tissue, generating measurable field potentials. These waves reflect massive, synchronized neuronal discharge rather than meaningful information processing. They represent a final surge of electrical activity driven by catastrophic ionic imbalance. Spreading depolarizations observed in brain injury models mirror the waves seen post-mortem. It is like a stadium wave continuing across empty stands after the game has ended. The brain's dense interconnected networks facilitate rapid propagation of depolarization once triggered. Even as global energy supplies dwindle, local clusters with slightly higher ATP may sustain brief synchronous firing. This network architecture thus allows coordinated bursts rather than isolated random spikes. Hippocampal circuits show prolonged bursting compared to other regions due to their recurrent connectivity. It is like a chain of dominoes, falling in sequence long after the initial push. Neuronal membranes exhibit nonlinear responses once ion concentrations cross critical thresholds. Small changes in extracellular potassium or calcium can trigger large-scale electrical waves. These threshold phenomena mean that dying tissue can switch abruptly from silence to burst activity. The result is transient oscillations that belie the overall metabolic collapse. Elevating extracellular potassium by just a few millimoles can provoke spreading depolarization in cortical slices. It is like a powder keg igniting with a tiny spark once pressure builds past a tipping point. Post-death brainwaves raise questions about residual awareness and the window for successful resuscitation. Although these signals are pathological rather than conscious, they may reveal a brief period when neural circuits remain excitable. Understanding this window could inform the timing and methods of CPR or neuroprotective interventions. It suggests that the boundary between life and death is not an instantaneous flip, but a dynamic transition. Controlled hypothermia applied within minutes post-arrest can preserve neuronal viability and improve outcomes. It is like catching a falling glass by slowing its descent rather than letting it shatter and then reconstructing it. Detecting faint transient brain signals amid severe ischemia requires sensitive electrodes and noise suppression. Distinguishing pathological depolarizations from meaningful brain rhythms is also difficult. Moreover, postmortem artifacts or electrode drift can mimic genuine activity. Reliable interpretation thus demands rigorous controls and multimodal monitoring. Intracranial EEG in animal models must account for temperature-dependent electrode impedance changes. It is like trying to discern a whisper in a windstorm without false echoes. Advances in ultrafast imaging and metabolite sensors may map the spatiotemporal dynamics of post-death electrical waves in vivo. Integrating computational models of ion kinetics with network simulations could predict the onset and spread of these signals. Such insights might refine brain death criteria and optimize neuroresuscitation protocols. Ultimately, unraveling the mystery of post-death brain activity will deepen our understanding of the dying process and the thresholds of life. Novel genetically encoded voltage indicators are being tested to visualize depolarization waves in real time. It is like upgrading from slow map to high-speed videography to capture the final moments of a bursting firework.